Hey there, Caps of Ham. Welcome back to the channel where we break down medical topics and make them easy to understand. Today, we are diving into a virus that's been making headlines recently, Nipah virus. If you have heard about it and want to know what it's all about, from how it spreads to what you can do to protect yourself, stick around. But before we jump in, don't forget to hit that subscribe button and tap the bell icon to stay updated on all the things health and science. Let's get into it. Nipah virus. What is it? Nipah is a zoonotic virus, which means it's transmitted from animals to humans. It comes from a virus family called Paramyxoviridae, and fruit bats, especially ones known as flying foxes, are the natural hosts. How does it spread? There are two main ways. One from animals, like infected bats, to humans. This can happen when people come into contact with contaminated fruits or even raw date palm sap. The other way is human to human transmission, which happens through direct contact with an infected person's body fluids, like saliva or blood. So it can spread pretty quickly if proper precautions are not taken. What happens in your body when Nipah virus gets into your body? It does straight to work by attacking your cells. The incubation period, or the time before symptoms show up, can be as short as 4 days or as long as 45 days. Once it spreads, it can cause serious problems like brain inflammation or encephalitis. This is why Nipah is such a scary virus. It does not just stay in one place, it affects your lungs, brain, and even other organs. Now let's talk about the symptoms. Early on, it might just feel like the flu, fever, headache, muscle pain, or a sore throat. But if it gets worse, you could experience confusion, difficulty in breathing, and even seizures. Some people can also develop serious respiratory issues and, in some cases, coma. Nipah can be fatal, so early detection is super important. Recently, Nipah made the news again. In 2023, there was an outbreak in Kerala, India, where a few deaths were reported. Authorities acted fast to contain the virus using methods like contact tracing and isolation. India is not the only place, though Bangladesh has also seen outbreaks in the past and this year, especially during the colder months when people consume raw date palm sap. Now, how do you treat it? Unfortunately, there is no specific treatment for Nipah virus yet. Doctors usually focus on supportive care like keeping you hydrated and managing complications like breathing problems. Researchers are also looking into new treatments, including experimental drugs and monoclonal antibodies. And though there is not a vaccine available right now, scientists are working hard to develop one. How can you protect yourself? Prevention is key when it comes to Nipah virus. Avoid eating fruits that might have been bitten by any kind of bats or flying foxes. And definitely don't drink raw date palm sap in outbreak prone areas. For healthcare workers, wearing protective gear and practicing good hygiene is super important. If you are in an area where Nipah has been reported, follow public health advice like social distancing and wearing masks. And speaking of food, what should you eat to stay safe and healthy? Well, first off, Avoid raw or partially eaten fruits in areas with known bat actively. Also, in general, it's good idea to support your immune system with a healthy diet rich in vitamins and minerals. While that won't protect you directly from Nipah, it will keep your body strong only. So that's a wrap on today's deep dive into Nipah virus. It's a serious virus, but with the right information and preventive steps, we can protect ourselves and our communities. Remember, knowledge is power, and staying informed is the first step towards staying safe. If you found this video helpful, give it a thumbs up and share it with someone who might need to hear this. And if you are new here, don't forget to subscribe to CAPSA and join the fam. I will see you in the next one. Stay healthy, stay informed, and take care. Bye.